Welcome back. Joining us in the studio, we have Dr. Erica. It is Men's Health Month, and you have some kind of, well, I would say maybe alarming statistics, but maybe it's not that alarming. Men don't like going to the doctor, right?
They don't. They
Yes.
don't. So yes, Men's Health Month, Men's Health Week with Father's Day coming up this weekend.
Yeah.
Before we can even talk about the prostate cancer, the testicular cancer, and things unique to men, or the three most common deaths in men is going to be from heart disease, cancer, and COVID-19 as of 2021 data.
Okay.
We have to talk about getting men to the doctor in the first place.
Right.
So I thought maybe we could talk a little bit about that and encourage the men watching today, as well as people who could encourage the men to go to the doctor to do that. So obviously, men are less likely to seek health care than women. When they did some studies, you can see on the board that only 68% of men identified a clinician that they see for routine care, compared to 81% of women. And 75% of those men have only seen that provider in the last 2 years, compared to 91% of women. Also, the Cleveland Clinic had a campaign where they did a little more details of why men are not going to the doctor. They also found that 72% said they'd rather be doing household chores than going to the doctor,
Wow.
including cleaning the toilet.
Really? They would rather clean the toilet than go to the doctor?
Apparently. And then 65% say if they do, they wait as long as possible to go to the doctor. And then, alarming is that 20% say that they're not always honest with their doctor when they do finally go to the doctor, and 37% say that they've withheld information from their doctor when they go to the doctor.
My goodness, men, what are you doing
I
out
know,
there?
it needs to change. So it needs to change because 13% of men 18 and older, according to the CDC, are in fair or poor health. 31% have had more than 5 drinks on one occasion at least once in the past year. 14% smoke cigarettes. 41% fall into the obesity category. And 52% have high blood pressure, which leads to other problems and is best when you can identify it and treat it early. Also, in addition to just regular health care, mental health care, men really don't want to address that. So we also see that the suicide rate among American men is about 4 times higher than that among women. Also, white men aged 85 and older in that demographic have the highest suicide rate of any demographic. So men need to go to their primary care physician. They also need to reach out to mental health care, and through your primary care is a good way of doing that. Men are dying more related to that, to alcohol, to drug misuse. So the bottom line is, with Father's Day coming up this weekend, if you haven't gotten a Father's Day present yet for the men in your life, or for the people who are not fathers, and it's Men's Health Month, I'm sure they would appreciate an appointment for their primary care doctor.
Would they? But no.
No, they wouldn't.
But we could surprise them anyway.
But at least give them that first step. And then, you know, the more you get to know and trust a primary care doctor, I think the more you feel comfortable opening up and not withholding information from them, and identifying things early, and identifying things that may not have outward symptoms, and not waiting too long. And when you do get sick, you have someone to go to. So
well, at least it could start that conversation.
Absolutely.
So, okay, well, Dr. Erica, really great statistics to share. We hope all the men out there are listening and take that to heart.